Symptoms of cervical cancer are abnormal bleeding, typically during intercourse, abnormal pap smears.
Well, I'm a labor and delivery nurse. I would just say get a pap smear. Get your pap smears. Get a pap smear.
It is amazing how many advanced cervix cancers can be prevented by just going in and having your pap smears done. I can't stress this enough.
Tengo 24 años y esta fue la primera vez que fui a hacerme un pap smear porque una amiga me dijo que debería ir a hacérmelo porque es un examen muy importante. Pero en la cultura latinoamericana uno solo va a hacer el pap smear cuando uno está embarazada o cuando uno siente que algo no está bien en su cuerpo. Pero me siento muy feliz de que fui a hacerme el pap smear y yo quiero que toda mujer joven sepa de que ellas deben de ir a hacerse el pap smear.
It's estimated in the United States that half of women who get cervical cancer in the United States have never had a pap smear in their entire life, and another 20% haven't had a pap smear in the last 5 years or within screening guidelines.
Yo le dije para el año siguiente, y el año siguiente ya marcó una gran diferencia, un sufrir extra que me gané por decir, me lo hago el año siguiente.
Young women, particularly women in their teens, need to think strongly about the use of the HPV vaccine, which has the potential to eventually eliminate cervical cancer in the United States. In contrast, older women, for the most part, need to be simply more aware of their bodies. They need to be concerned with changes in the way they perceive their body, changes in things like appetite and bowel movements, or bleeding. Irregular bleeding from the vagina is probably the single most common symptom associated with the cancers that we deal with.
We know that most cervical cancers are associated with the human papillomavirus infection. So if we can prevent that infection by vaccinating patients early, then we are able to help prevent the development, hopefully, of a potential cancer in the future.
And in most women, that's just an infection that you live with. You have no symptoms. You don't even know it exists. But in some viruses, they have a predisposition to actually change those women's cells forever. And because it's silent, until cancer is developed, there are no symptoms. Even early cancer often doesn't have symptoms. The only way to know that the virus is there and doing this is with a pap smear. And that's why pap smears are so incredibly important.
Cuando lo hice, le dije a mi mamá de que me fui a hacer el pap smear. Estaba un poquito nerviosa de lo que me iba a decir mi mamá, porque otra vez para nosotros solo se va a hacer en ocasiones de emergencia. Entonces le dije a ella que ella debe de ir a hacerse un pap smear. También se lo dije a mi hermana y lo van a ir a hacer, así que me siento muy feliz de haberles compartido esta información a ellas.